Less than a day after the state attorney general's office decided not to seek charges in Dante Melton Jr.'s case, his mother spoke with WJZ today saying his city failed her son. The medical examiner in this case ruled Melton's death as a homicide, but in their report, investigators say the officers took the appropriate measures to assist Melton.
Dante has gone to an officer before who helped him get to the hospital. That didn't happen this time. The complete incident was a failure. But I have to live with that every single day. That I saw my son walking, talking, active, going to the police as he was taught to do, and they failed him miserably.
And the ambulance meant to assist Melton never came because of a breakdown of the city's emergency dispatch system. Melton's mother tells us she has heard about the mistakes that were made, but says what happened to her son can never happen again. Well, within the past hour, the Baltimore City Council wrapped up a meeting on how to improve the city police department and the way they respond to mental health crisis. This comes after the death of Dante Melton Jr., and a woman was shot and killed by police who was also experiencing a behavioral health crisis. WJZ Live at 7 o'clock tonight. Our Tara Lynch on your corner at Baltimore City Hall here at 7. Tara, that meeting brought in experts from all across the country after the city was scrutinized over both of these deaths.
Yeah, Rick, that meeting just wrapping up right now with many of the city council members in attendance. We heard from a lot of behavioral health experts and police experts, not only from here in Baltimore City, but from Durham, North Carolina, and even Denver, Colorado. The council is considering adding a civilian response unit, which would be a non-clinical, non-police response team that could go out to these types of qualifying calls. Baltimore City Council held a similar meeting back in August after Baltimoreans experiencing behavioral health issues died in police custody or were killed in a police-involved shooting. The council says the current 911 and 988 program has resource constraints and is limited to helping only urgent calls. Behavioral Health Systems Baltimore says the council should create a community safety responder system that can be dispatched from 911 and also invest money to repay school loans for social workers who work in crisis response services. Tonight, the council is hearing from experts about how to use trained civilian responders during nonviolent and non-criminal calls.
Civilian teams could provide assessment, de-escalation, conflict resolution, and resource connection. Civilian response services are not behavioral health specific. A civilian responder could find that there are behavioral health issues that surface and then work with the person to get them connected to resources in the community, which may include calling 988 and the deployment of a mobile crisis team.
The Baltimore City Behavioral Health Collaborative is meeting later this month to discuss more of this, how they can expand the already existing programs that are here in the city. And coming up at 11, there were a lot of questions from council members. How much will this expansion cost? What do these people need to expand the program in general? And how can we make sure that when Baltimoreans call 911 or 988, that resources are responding quickly? We'll have all of those questions and some answers coming up tonight at 11. For now, reporting live on your corner at Baltimore City Hall, Tara Lynch, WJZ.
An expansion that's been talked about for quite some time. Tara, thank you.